Perfect. So thank you everyone for coming to this evening's webinar on understanding hepatitis D. My name is Ashley Lawrence, and I'm the Digital Communications Coordinator here at Liver Canada, and I will be the host and the moderator for the webinar this evening. Just as a reminder, if everyone can please stay on mute for the rest of the webinar. If you do have any questions, please feel free to enter them in the chat. And then if there is time remaining at the end, we can get those answered for you during the Q&A session. Just before we get started, I wanted to thank Gilead for supporting the event this evening. Liver Canada is located on the traditional territories of the Anishinaabe and the Haudenosaunee Mississaugas and the Mississaugas of the Credit First Nation, and we acknowledge and extend our gratitude and respect to all First Nations, Inuit, and Métis people for their valuable contributions. For those of you who may not be super familiar with Liver Canada was first established in 1969, and it was the first organization in the world created to help people with liver disease. We are committed to promoting liver health and improving the prevention, the diagnosis, and the treatment of liver disease in Canada through funding different research initiatives, different education programs, patient support, and advocating for liver health policies. Joining us this evening is Dr. Carla Coffin. Dr. Coffin is a liver specialist and researcher at the University of Calgary and known internationally for her work on hepatitis B and hepatitis delta. She's a professor of medicine at the Cummings School of Medicine, University of Calgary, and the medical director of the Calgary Liver Unit, Division of Gastroenterology and Hepatology, Alberta Health Services. As for the agenda today, I just went through a brief introduction. Then I'm going to launch some poll questions just to see everyone's current knowledge on the topic. Then Dr. Carla Coffin will give her presentation on hepatitis D, and then a final poll just to gain your feedback on the session today, and a Q&A if there is time remaining at the end as well. So I'm just going to launch those initial poll questions here. I'll give you a few minutes to answer those. Can everyone see the poll questions okay? Okay, great. Just give one more minute to answer those questions. Perfect. Thank you so much for participating in the polls. I'm going to end them here. I now invite Dr. Carla Coffin to share her slides with us today.
Great. Thank you. Let's hope I can manage to do this without any problems. Now, can you see my screen?
Yep. Not the presentation yet. There we go.
Can you see my presentation?
Yep.
And then I'll put it in slideshow. Now, is all good?
Perfect.
Okay, great. Well, thanks so much for Liver Canada for inviting me to give this talk. I should correct in that I'm not actually the director of the liver unit anymore. My colleague, Dr. Stephen Congley, has taken over, but I'm still director of the viral hepatitis clinic. And I would also like to acknowledge that I live and work in the beautiful city of Calgary and the University of Calgary, which are located on the traditional territories of the people of Treaty 7 in southern Alberta. And we're also home to the Métis Nation of Alberta, Districts 5 and 6. So thanks to everybody for taking the time this evening to join and listen to my talk. I'm a professor of medicine and I do a lot of research at the University of Calgary. We participate in clinical trials testing new drugs with other colleagues within the University of Calgary Liver Unit. I should disclose that I'm not receiving any payment for this presentation. These slides are my own or used with permission. I would also like to give a shout out to Liver Canada, formerly the Canadian Liver Foundation. They funded my master's studentship in 1994, and that's the reason why I became a hepatologist, because they funded my research at that time when I was just doing my master's degree. Okay, so we're going to talk today about hepatitis delta, obviously, if that's why you've joined the webinar. We're going to go over how you get it, and I think many of you were right when you answered the poll questions. How can we prevent delta? How is it diagnosed? How it can affect the liver, and how it is treated. And I'd also like to sprinkle in a little bit about the research that we're doing through the Canadian Hepatitis B Research Network. So first of all, a shout out to the liver, and I'm using my picture of my dog, or my kid's dog, I guess our family dog. He's a miniature Yorkie, and he thinks that he's a superhero. He takes its job very seriously of protecting our house and making sure that no strangers or nobody will do anything to harm the family. So he's like the Newfoundland dog, a superhero. I'm from Newfoundland, so I always sort of love to show pictures of that dog. But the liver is truly a superhero. It has over 500 different functions. It has ability to clean your blood, to filter it. It stores and releases energy, and it manufactures many essential body proteins and hormones. So you cannot live without your liver. Obviously, as you guys might know, there's no such thing as liver dialysis. And arguably, I think one of the most important organs in the body, but I think it gets a bit underrated or underappreciated by many people in terms of how important your liver is. So we're going to talk about viral hepatitis, or a condition that affects your liver. It is an infection that causes inflammation. So itis, it's actually derived from the ancient Greek term, and of the liver, meaning hepa. When you get viral hepatitis, it makes it harder for the liver to perform all of these amazing functions we talked about. It's caused by viruses that are spread in different ways, and I'll go through them. In some viruses, the infection can become long-term, and the medical term is chronic when it stays there for many, many years. And some of these chronic virus infections, if it's not treated, can lead to severe damage, including cirrhosis, which means very severe end-stage scarring, and even liver cancer. However, there are some of the viruses that people, if they get it, they can recover on their own without needing treatment. And I'll explain that in my next slide. So this is the alphabet soup of viral hepatitis. So hepatitis A and B, interestingly, was actually discovered around World War II, when doctors noticed that the soldiers during the war, some were getting sick, getting yellow, and meaning that their liver was sick from eating contaminated food or water. They also noticed that some of the soldiers were getting sick by being exposed to certain blood products or other body fluids that contained a different kind of virus. So they named these two virus infections without really understanding too much more hepatitis A and hepatitis B. Fortunately, we've come a long way in that now we have a vaccine available for both hepatitis A and hepatitis B. Hepatitis A, you tend to get better on your own. It's like food poisoning, so you don't typically need to get treated for Hep A. But we do recommend that you should get the vaccine, especially if you're traveling somewhere where there's maybe hepatitis A present in the food or water. And also if you have other liver diseases, get the vaccine. Hepatitis B, there's a vaccine available. The virus was actually discovered in 1976 officially. And the guy that discovered it, Baruch Blumberg, he actually got the Nobel Prize. And we do have treatments available that can control the infection, but to date, we don't have a cure, but lots of research is being done for that. Hepatitis C was initially called non-A, non-B, because no one really knew what it was, so they said that's what we'll call it, non-A, non-B. But it was actually discovered in 1989, or formally discovered. And since then, it's been remarkable advances in that they found a cure from the time it was discovered in 1989 up to like the mid to late 2000s. So now most of our patients with Hep C, or all of our patients basically, can be treated and cured, but there's still no vaccine, so people are working on it. What we're talking about today is hepatitis delta, and I'll jump back to that one, but I'll finish off with hepatitis E, which was discovered in India in about 1983. And they found it was spread through contaminated food or water. There is a vaccine available, but only available in China or India. Interestingly, you can get Hep E from eating contaminated pork or undercooked pork. So there's some places in Europe especially. There's no treatment, but it's usually not needed. Most people recover. So hepatitis D or delta, some people call it the devil because it is actually the worst kind of hepatitis. You can only get it if you already have hepatitis B. So the B and delta go together. If you get the vaccine for hepatitis B, you're protected against delta, but there's no specific vaccine for delta. And there's also no cure for it. So historically, it's been called an orphan disease because it had the least amount of treatments or least amount of ways to prevent it. So because you need B in order to get delta, I'm going to tell you a bit about hepatitis B in terms of how important it is globally. So it is the most common type of viral hepatitis in the world. Estimates about 250 million people, even though we've had a vaccine for about 40 years. Unfortunately, we all have good treatments, but less than 10% of people are treated. Many people don't know they have hepatitis B, so they're not being screened. The World Health Organization estimates about one death every 30 seconds. In Canada, our estimates are about 250,000 people with hepatitis B, and our research studies have shown that these patients have about 4 times a higher risk of death or severe liver disease compared to the general Canadian population. So a very important disease to know about. About 5 to 10% of people with hepatitis B also have hepatitis delta. So if my previous slide said 250 million people, although I did also say we're not quite sure that's the exact number, but that's what our estimates are, then about 15 to 20 billion are estimated to have hepatitis delta. So certainly not a rare condition when you think about like how many people have this in the world. So why is D called the delta? So, as I'd mentioned, 15 to 20 million people potentially have it. We need to do more to screening. There's very high rates of severe liver disease, cirrhosis, and liver cancer. We need to do more research to understand why this happens. Until recently, only a very toxic injection type of therapy called interferon was available. There is some new drugs that are coming out, and I can tell you about one in particular. Interferon never really worked that well, and you can't use interferon in people that have very severe liver disease or cirrhosis. Recently, the International Agency for Research on Cancer classified the hepatitis delta as a class 1 carcinogen. So this is an important designation, meaning that this virus puts you at high risk for cancer. I'm not going to show too much of this, but just so that you can appreciate a little bit of about the virology. It's considered the smallest of all known human viruses. And because you need the Hep B to get infected with Hep Delta, it's called a defective virus. It can't do it on its own. It uses the outer part of the hepatitis B virus. So that blue part, that's the outer part of the Hep B. It takes that and uses it for itself. So that it sort of hijacks that and uses that to cover itself. And that's how it's able to enter into the liver cell. How was the Hep Delta transmitted? Many of you got this correct when you answered the poll. It's by blood and body fluids. So examples would be blood transfusion, medical or dental procedures, getting needle sticks. But that's only in regions that don't have strong public health precautions. Fortunately, in Canada, we can be very confident in our healthcare system that if you have any medical procedures, you should be safe. Also, if somebody that has hepatitis B and hepatitis delta together, and if you're not vaccinated against hepatitis B and you have close contact with them, either from intimate contact or sharing personal items such as razors or toothbrushes, you could get exposed or infected. And if you use injection drugs and needles that are not clean or sterilized. As I'd mentioned, if you get the Hep B vaccine, you're protected against B and Delta. But if you already have Hep B, then there's no specific vaccine just for Delta alone. So how do you prevent? I guess my previous slide should make this obvious, but in order to get protected against B and Delta, just get vaccinated against hepatitis B. I actually strongly encourage all adults to do this. In Canada, the children are vaccinated, but if you were born after 1982, you wouldn't have gotten the Hep B vaccine unless you decided to go and ask your family doctor or go to a travel clinic to get it. And if you get the Hep B vaccine, you're protected against B and you're protected against the devil, Delta. And I also encourage people to get tested for Hep B because a lot of people have it and they don't even know because it can sort of act as a silent and hidden infection. And if you're living with hepatitis B already, there's no specific vaccine for hepatitis delta, but you can still protect yourself by, making sure that your partner has been tested and negative, and if not, practice safe sexual practice. Avoid sharing needles or drug use equipment. Fortunately, in Canada, we don't have to worry too much about medical equipment and tattoo procedures, but certainly if you go to a tattoo parlor, make sure and check that they're a reputable place and they're using sterile equipment. And then avoid sharing personal items such as razor blades and toothbrushes, which I think it's a bit of an obvious thing that we shouldn't do that anyway for a number of other hygienic reasons. So why is Hep Delta so bad? It's not like you're saying 1 + 1 = 2. It's like you're adding gasoline to the fire when you add hepatitis Delta into hepatitis B. It's interesting. It was discovered by a pathologist in Italy, Mario Rossetto, and he was looking at liver biopsies from patients that had Hep B, and he noticed that some of them were just a lot sicker than those that had Hep B alone. And he found that they had this funny looking protein or antigen within these liver biopsies of those patients. And that's how the hepatitis delta was discovered. So you can get hepatitis delta as an acute or sort of a brief infection, or it can become chronic or long-term. As I mentioned, it's the devil, causes the most severe form, and it increases your risk for really severe liver disease. It speeds up the rate of liver damage. Like some people with Hep B, it can be very slow progression, but if you have Delta, it's like it just goes whoof. It can go super fast, even within 5 years. It increases your risk of liver cancer. It's a class 1 carcinogen, and also risk of liver failure or your liver not working in the setting of cirrhosis and needing a liver transplant. So the ways that you can get Hep Delta is at the same time, you haven't gotten the Hep B vaccine, so you get exposed to blood or body fluids somehow, and you get both B and Delta together. And in these people, 10% go on to have a chronic or lifelong infection. Or you already have Hep B, you got it at some time many, many years ago, and then you got Hep Delta from another source on top of it. So already living with Hep B and you get Delta. And up to 80% of those go on to have a persistent or long-term Delta infection. Once you get the two of it together, compared to just having one virus, there's 2 to 3 times risk of cirrhosis, 2 times risk of liver failing or stop working, 3 to 6 risk of liver cancer, and up to 2 times increased risk of transplant. So overall, up to 70% higher risk of up to 70% of people have liver failure, cirrhosis, and liver cancer. So extremely high rates. What about hepatitis B in Canada? We didn't have really large nationwide studies until relatively recently. And this was done through the Canadian Hepatitis B Research Network and led by a colleague, Dr. Carla Coffin. She was former chief of viral hepatitis testing at the National Microbiology Lab in Winnipeg. She's retired recently. But Carla looked at over 7,000 samples that were sent to the lab in Winnipeg to be tested for hepatitis delta. So they already had Hep B and sent to be tested. And when they did their testing, they found 5% were positive for hepatitis delta. And in those 5%, about 2/3 or 60% had an active infection, meaning that the virus is very active. And we checked our registry, meaning our patient charts that we had collected through the research network of 135 patients that had Delta. And we found that it was associated with previous risk factors, the risk factors I talked to you about in terms of, being exposed to contaminated blood, etc. It was found in both people born in Canada and born outside of Canada, and these people had high risk of severe liver disease. So this was a large study that really showed data from Canada. We did a follow-up study that we presented as a poster, and I'm hoping to write this up soon. And in this study, also looking at our registry or our collection of data from patients across the country, we found that on 126 patients, or I'm sorry, 158 patients, 43% had cirrhosis, very severe liver disease, 7% had liver cancer, and 4% of those had underwent a liver transplant. So showing in our patients in Canada, very severe outcomes from Delta. So based on the studies that were done by Dr. Coffin and some others, the prevalence of hepatitis delta in Canada was updated by a national modeling research observatory called the Polaris Observatory. So in 2023, they said, based on our estimates, there are 214,000 people with hepatitis B. Based on the adjusted percentage, using the literature, using the publications, about 3% have hepatitis delta, meaning that there are about 4,100 people that have hepatitis delta with active ongoing infection. So they concluded that in order to diagnose delta in Canada, you need to test about 33 patients with hepatitis B. And why this conclusion is important is that it demonstrated that it was cost effective. In our medical system, we pay for it, our taxpayers pay for it. We don't want to be doing a bunch of tests without good reason. So this showed that if you're only needed to test 33 people to get one positive, it's cost effective. It makes sense to do that. And hopefully you appreciate that. We don't want to be wasting money if we don't need to. So how do we test? So the most important test is called the hepatitis B surface antigen, so HBsAg. If it's negative, I'd mentioned to you before, check if you are protected, if you have antibodies, and if you should get the vaccine. But that's a question you can ask your primary care provider or your nurse, your family doctor. And then if the surface antigen is positive, then you check the hepatitis delta antibody. That's another blood test. And if that is positive, then you check to see if the virus is active. And that's, you do another blood test called the delta RNA. And then finally, you do a bunch of other tests to just check and see if there's liver damage or liver scarring. You don't need to remember all these medical terms. Just know that it's diagnosed by simple blood tests. We also have read and appreciated stories that, I've already talked to you about how you could get really severe liver disease, but it's important to appreciate that patients, how they feel is been recognized. So this was a nice study done by a group in Spain, and they looked at people with Delta and with hepatitis B, and they asked them questions. How do you feel? How is this affecting your quality of life? And they found that people that had hepatitis Delta compared to people just with hepatitis B had worse scores. They felt they were worried more. They had more, abdominal or stomach symptoms. They physically felt worse. Their emotional well-being was worse, and their ability to work and do their activities and enjoy life was worse. So not just the clinical findings, which as physicians we always talk about, but just the emotional and physical well-being. So we have recently published guidelines on hepatitis B and hepatitis Delta in Canada, published in the Canadian Liver Journal. We recommend that all people living with hepatitis B should be screened for hepatitis Delta. It's cost effective, and it's important to know so that you can monitor these patients. They're at risk of worse outcomes. In the past, the only treatments for hepatitis Delta was this interferon, and it was a very terrible treatment, hard to tolerate with lots of side effects, and really didn't work that well. And we'd recommended that you should send patients to go to specialist centers, such as, larger centers in Calgary or in Alberta and Ontario to be treated. There are good drugs for hepatitis B. Another time we can talk about these drugs, but they're called nucleoside analogs. They're entecavir or tenofovir. They don't work against the hepatitis Delta, but we do recommend that you should treat the Hep B just to make sure that is under control. And you already know, because I've told this 3 or 4 times already, get the Hep B vaccine if you haven't been already vaccinated, because it will prevent you against getting B and Delta. There is a new therapy for hepatitis Delta that has recently been approved by Health Canada. It's called LIVERight. And we recommended when we published our guidelines a few months ago that as these new therapies become approved, make sure that they're prioritized for people with hepatitis Delta, because these patients are at very high risk for advanced liver disease. So LIVERight is an interesting drug. And it actually blocks the hepatitis Delta from entering the liver. So your liver transports bile acids to help with digestion of your food. And it uses this, what they call NTCP, which is a bile acid transporter. That's how the Hep Delta and the Hep B gets into your liver. It binds to this bile acid receptor. And what the drug does, bulevirtide, it swoops in and it just blocks that receptor and prevents the hepatitis B as well as the hepatitis Delta from getting into the liver cell. So that's sort of a brief, 5-minute or 5-second science sort of to show how the bulevirtide works. And it has been shown and effective at preventing or delaying disease progression in people with Delta. I'm not going to show you research studies, but I'll show you what we have found from the Canadian Hepatitis B network. So there were clinical trials showing the benefits of bulevirtide and Delta, but I'll show you some real world data, meaning that actual patients that got bulevirtide. So this is 13 patients, and you can see here varying ages, but very young people, born in many different regions of the world. Some of them had gotten interferon and it really didn't work. All of them had pretty bad or showed signs of liver damage from, abnormal liver tests and abnormal tests showing liver fibrosis. Some of these patients had very severe liver disease, which is by these comments I have on the side, including liver cancer. And you can see from these numbers, red numbers, high levels of the virus in their blood, high levels of RNA. This is data that was presented last January, but we showed that in many of these patients, 13 patients, when they got treated with the bulevirtide for several months, you can see that their liver tests got better, their virus levels decreased dramatically, and many of these people are continuing to do very well with treatment with this almost like miracle drug. That I told you before, Delta, the devil, people go on to get, their liver fails, but at least with these treatments, they're doing very well. So summary about Delta, as I'd said before, historically it's called a orphan disease, high unmet need and disease burden, similar to some cancers, 60% mortality within 10 years, 60% death, high cost of needing a liver transplant. So estimates of about $570,000 for liver transplant. In Alberta, after the first year, estimates of liver transplant about $170,000. This is data from one of my colleagues, Dr. Congley. And unfortunately, it's not easy to get a transplant. About a quarter of people that are waiting to get a transplant, they die before it's available. This is a little bit outdated in that there was no approved treatment in the US or Canada, but now bulevirtide was just recently Health Canada approved, but we're waiting for it to go through the different provincial provinces, jurisdictions to get approval. So key takeaway points from my talk, and we have lots of time for questions at the end. So Delta causes the most aggressive form of hepatitis known in humans. So we have A, B, C, D, and E, but Delta is the worst. It is a satellite virus or a defective virus. It needs the hepatitis B virus to survive. We recommend screening, checking for hepatitis Delta in all people that have hepatitis B, because it's important to know that they have it and to follow them and to know about potentially treating them. There's an urgent unmet need for approved therapies, but there's a glimmer of hope in that there are new drugs promising, including one recently Health Canada approved. Because you need Hep B in order to get Delta, if we cured hepatitis B, it would benefit hepatitis Delta. And so there's lots of work being done to actually also find a cure for hepatitis B. We recommend that if you have B and/or Delta, make sure that you talk to your family doctor and to be referred to a specialist and discuss about treatment options. And then finally, a plug I want to say is that everybody should get the hepatitis B vaccine as soon as possible after birth. But if you haven't been vaccinated, then also get the hepatitis B vaccine because that'll protect you. And thank you. Open to any questions, and it's
Great.
wonderful, everybody. Yeah.
Thank you so much, Carla. Definitely an amazing talk with a lot of information. I know our community will greatly benefit from this talk now or in the future on our YouTube channel. I'm going to launch the poll questions just before we jump into the Q&A portion here. Just going to launch that now just to gain your feedback and your thoughts on the session today. Is everyone able to see the poll questions? Give it just one more minute here. Perfect. Thank you so much, everyone, for sharing your feedback on today's session. Um, just share my slides again quickly.
Oh, I should stop share.
Perfect. There we go. So now is the Q&A. If anyone has any questions, you can now drop them in the chat and I can read them out, and Carla is available to answer them. We have a question here. Is hepatitis D screening routine when being screened for hepatitis B, or is it something that should be specifically asked for?
That is an excellent question. Historically, no, it wasn't routinely being done. But we have recently updated our guidelines to say everybody should be screened. But there may be some people that are not aware of these new recommendations. So I would ask to be screened. Of course, you have to already have Hep B in order to get Delta. So they won't screen you unless you already have hepatitis B, as we talked about. Yeah. So
Great.
always good to ask.
Thank you.
I'm happy to talk about other liver questions. Doesn't have to be about this, but if you have other liver questions, I can try to answer.
Now's a great time. It's hard to get in contact with hepatologists and getting the referrals. So if anyone has questions about any other general liver health questions. Looks like you covered it all in your presentation, Carla. Give it just a few more minutes if anyone has any questions. If anything ever comes up, you can feel free to contact our patient support. We have a great team who is very knowledgeable about different liver diseases as well. So if anything pops up after the presentation, you can contact us there as well. Someone said the vaccine
Okay.
in 1990, should I get screening test?
Okay. So if you're vaccinated, and if after the vaccine you've been tested and it showed that you have antibodies, then you're good. It's been shown that 40 years later, so probably for the rest of your life, you're protected. But if you're at risk of ongoing exposure, so for example, let's say you're going to go work in healthcare, you're going to go and be a nurse or a doctor, or if you have someone you're in close contact with hepatitis B, you might want to get checked just to make sure that the vaccine was protective. But it's only for people that would be at risk of ongoing high risk exposure, and the general population, because we live in Canada and we have a safe healthcare system in terms of medical care and dental procedures, there's no need to get screened. Yeah. Oh, retired from healthcare. Okay. So you're probably good. All good. So the answer is generally no, unless you have risk factors.
Great, thank you. Last call for any final questions.
Okay, that's a good question. So, perhaps I didn't go through my slide fast enough about how, perhaps I went through the slide too fast to talk about bulevirtide. So it lowers the liver tests that show you have liver damage. So it lowers the, liver enzyme tests. It also lowers the, or shows improvement in the tests we use to check for liver scarring, so like the FibroScan test. And people that have decompensated liver disease, or people that had signs of liver failure, they got better. So clinically, they got better. So, if they'd had complications of fluid buildup, ascites, or complications such as bleeding, that improved. Clinically improvement with bulevirtide, as well as improvement in the liver numbers. And then there's a question about traveling. So do you need to get the Hep B vaccine for traveling? Not typically, because Hep A vaccine, yes, because you could get it from contaminated food or water. But if you're going to an area where you might get health care in a region, like if you're going and you might need to see if injection drugs or healthcare, that would be the only potential exposure to hepatitis B. I'm happy to say, though, that many regions you go, they have very good, often good healthcare systems for hepatitis B. But I also recommend everybody should get the Hep A and the Hep B vaccine to make sure you're protected. Lifestyle changes that can help manage hepatitis B or hepatitis in general. There's nothing specific. It's general healthy lifestyle, like a for healthy liver. So many people are at risk of, we used to call it fatty liver disease, but now the medical term is metabolic dysfunction associated steatotic liver disease. And the things that we talk about is, eating a healthy diet, following Canada's food guide, exercising at least 150 minutes per week or 30 minutes 5 times per week, minimizing alcohol, so low risk alcohol drinking, and making sure you get a good night's rest, and you have a good social support. So all the things involved a healthy lifestyle helps your liver, the same thing as any other sort of medical condition. Yeah, that's a good question. A lot of people thought fatty liver sounded a bit stigmatizing. And there is in particular thinking about children. So if you're telling a child, oh, you have fatty liver, and then you think about all the sort of nicknames and taunting, fatty, fatty, that type of thing. So they also wanted to make it sound like it actually reflected what was happening, like what was happening in terms of the medical processes. So when you say metabolic dysfunction associated steatotic, so steatotic is the medical term for fat, so steatosis, and dysfunction meaning that something with your metabolism is not working correctly, because your liver is like a factory that metabolizes and does a lot of different things. So the name change was to make it, one, sound less stigmatizing, and two, to actually reflect what was happening inside the liver. These are really good questions. So it's questions that even people that are health professionals and experts ask these questions. So I can see you have a very informed audience.
Any other questions for this evening? Again, if anything comes up after the meeting, you can reach out to us here at Liver Canada. Guess we'll move on for now in case something comes up. I just wanted to plug in here to stay connected to us. Follow us on social media, or Facebook or Instagram at Liver Canada. We're always posting the most up-to-date liver information, different research that's coming out, recipes, resources, and then visit our website. We have a bunch of great resources and information over there. We have our previous webinars posted on our website as well if you wanted to go take a look at those. A lot of great information on there as well, and to stay up to date on the different events and things like this that we are having in the future as well. So thank you everyone for joining us today. Thank you, especially Dr. Carla Coffin. It was an amazing talk. I know everyone will benefit from this information. It's definitely an important topic today. So thank you, everyone. I hope you have a safe and a wonderful evening. Thank you so much.
Thank you.
Thank you.